Guys, I'm just going to go over a regular EVD first. So your regular EVD, you have the transducing kind of cable that you use that goes into the brain. This is the end piece that goes towards the brain, into your drainage bag, and then the actual drain system, where you're usually leveling it to millimeters of water, not mercury. There is one new neurosurgeon that likes to use mercury for some reason. I think that's just how she was taught. But usually you level it to whatever the doctor orders, usually 0, 5, or 10. And then you have the drainage system, which collects in this little canister where you measure the CSF, and then you turn the little knob so that you can flush it into the drainage system, on and off, one-way valve kind of thing. And then to zero and level it, you want to make sure your little level system is, I'm going to drop this, in line with the tragus of the ear. You're going to open your one-way valve here. It's going to be off to the patient, opened to drain like it is here. And then you're going to get, that's going to zero it, because it's leveling at waters of the atmosphere pressure. And then you're going to flip it to get a reading from the patient. So this would be going to the patient, and you will get a reading off the monitor. Sometimes there will be the transducer is usually here, which this is missing, but the transducer that hooks up to the monitor is usually right here. And then when you're done monitoring and you need to continue to drain, you just close it off to the patient and just drain every hour, or just leave it open to let it drain every hour. Again, it's hard to kind of explain how to, use or set up one of these unless you actually do it hands-on. It's almost like a art line, but you have to use very sterile technique with this. So glove masks, chlorhexidine preps, sterile saline flushes to connect all this to the draining system when you're connecting it. And then all this setup is back here in the back in the break room on the wall. I think the very top shelves are where the EVD stuff is located. Okay, guys, this is the other EVD that you'll see here in the surgical trauma ICU. This is also known as a bolt. However, this is what Dr. Schreiber likes to use as a bolt / drainage EVD system. This is the Y connector that goes to the bolt, the reading ICP, and then the actual drainage system is connected as well to it. If it's just the bolt, you won't have this drainage system. You'll just have the bolt and then the Camino connected to the Camino device that is found in the break room. This little square thing is connected to this little square piece on the Camino system. And then when this is turned on and you actually have it connected to the patient, you'll see an ICP kind of waveform on this, and able to zero it and everything on the Camino. And that's where you'll be reading the ICPs from. This also can disconnect when you go to CT scans and to MRIs. Basically, this won't interfere with anything. You just disconnect there and it should be leveled. When you put the bolt in, the neurosurgeon usually levels it when it's placed, so you don't have to worry about anything unless you get weird readings, or there's a little metal part in the tubing that if that comes dislodge, or any part of the bolt system comes dislodge, you want to let the neurosurgery team know, and they'll have to come back and re-troubleshoot it. Yeah, Dr. Shibley likes to do both. He likes to monitor off the bolts side with the Y connector and also drain. But it works basically the same way as a regular EVD. He just likes the T connector with the little bolt system in it, so that's why we have this going on. And it's set up the same way, basically. I don't have much more to comment on that. I just wanted to show you the difference between the tubing of the two different things that you'll see and the Camino system and how it's connected to this actual box.
So do you know why Shibley prefers to use the Camino, whereas when we're doing ICPs for any other neurosurgeon, we're just hooking it up to the monitor?
I don't know why he likes to use this adapter. I just think that's something he's comfortable with.
Okay.
I think it's just something he kind of likes to use because he can decide whether he wants to drain or not drain. And he has that option where if he doesn't put it in, he might not have the option to drain or not. So I think it just allows him to critically think what he wants to do with the patient. Where if you just use the regular EVD drain, you can only drain, you can't, and monitor, you can't, not drain. You're going to constantly drain. I mean, we could not drain and just clamp it, but I think that's probably why he likes using this one over, it just lets him have the process of letting him think.